Hello, everyone. My name is Emma Anvari, and I'm a third-year student here at Monash. Today, I'm chatting to some of our nursing and midwifery students to find out a little more about their degrees and what it's like to study at Monash University. With us today, we have Chloe Slattery, who is studying a Bachelor of Nursing, Hannah Humphreys, who is undertaking a Bachelor of Nursing and Midwifery, and Keith Dwyer, who is completing a Bachelor of Nursing. Emma, I'd love to hear a little bit about, my name is Emma. Chloe, I'd love to hear a little bit about your degree.
No worries. Hi everyone, my name is Chloe and I'm currently in my third and final year of studying the Bachelor of Nursing at Monash University Peninsula campus. I am fortunate that I've always known that I wanted to do nursing. I am so fascinated and amazed by the human body and the technological advances we have to help save and enhance someone's life. I am so passionate about caring for people and creating professional relationships with them to help them get better. I am from New South Wales and explored a lot of universities to study at. Monash stood out to me because of the reputation it has, the commitment and friendliness of the staff to help students, and the amount of placement and hands-on experiences we get to do. Monash has offered me so many opportunities throughout my degree, such as being a peer mentor, which enhances my leadership and communication skills, or which are really important for nursing. There have also been a few nursing students create social sports teams, such as mixed netball. Monash has offered interprofessional learning days where we have been able to work alongside pharmacy and medical students, which is so much fun. Being at Peninsula campus, it really feels like a community where everyone is friendly and supportive of one another. I often study with physiotherapy and paramedicine students as it gives a different perspective of patients and helps broaden my knowledge. Placement is definitely my favourite aspect of the course. I have been able to work in so many different areas, such as paediatrics, where I could also spend a few days in the emergency department, acute medical and surgical wards, youth mental health, geriatric wards, and high dependency units. As Monash has such a great reputation, buddy nurses are always excited to take us Monash students under their wing and teach us as much as they can. Particularly this year with everything that is going on, there has been some challenges with placement. However, Monash really prioritises our learning, and fortunately, we have been able to continue our placement in a safe and supportive way. I have had a personal issue that has impacted my placement recently, and Monash have been so fantastic about it. I was given a buddy who was a staff member at Monash University who regularly called me to have a chat, to check in on me and offer any help and resources that I would need. I am so grateful for their support and it was fantastic having them call me. When completing a placement, students are given a facilitator, which is someone who essentially looks after you while on placement. They check in with you to make sure that you're happy with the nursing staff and the opportunities that you're getting. They assess us to ensure that we're competent. They give us extra learning support, such as when we're caring for a patient that we're not too familiar with their conditions. And most importantly, they make sure that we're comfortable. Monash have great facilitators that are offered to students. All of my facilitators have been so incredibly nice and they work really hard with us to ensure that we are achieving our best. I have loved my experience with Monash University. I've had so much fun and have had the opportunity to learn and do so much throughout my degree. I really couldn't recommend it anymore. Thank you.
That's so brilliant to hear, Chloe. Thank you so much. Hannah, would you please tell us a little bit about your degree?
Yeah, so hello everyone, my name's Hannah and I'm in my fourth and final year of nursing and midwifery. I chose nursing and midwifery very similar to Chloe. I always knew that I wanted to do nursing. I love helping people and hearing their stories. And nursing just provides an amazing opportunity to just get that follow through. And then in year 10, I heard of midwifery, thought I'd give it a go, and was very lucky to get in at Monash. And yeah, I just love the small community vibe of Peninsula, and that was really helpful for me coming from a small rural town, knowing that I'd be able to make friends. So it's been absolutely wonderful and I can't recommend it enough.
Brilliant. Thank you so much, Hannah. Keith, could you now tell us a little bit about your degree, please?
No worries. Good day, everyone. I'm Keith. I'm in my sixth and final year of studying Bachelor of Nursing part-time. It's been a really unique experience. As I'm sure you can imagine, choosing to study part-time has meant I've become part of the furniture around Monash Clayton. You get to know so many people. You get to experience so many different things. I've been to the Northern Territory with my degree. I've been up to regional Victoria. I've done all kinds of things I never imagined myself to do, such as working in COVID wards this year and seeing the inside of an ICU before graduating. And I just can't speak highly enough of the degree.
Brilliant. Thank you so much, Keith. I'll now move on to the question section of our panel today. I'll start with Hannah. What do you do during labs for your dual degree?
Yeah, so in first year, the double degree students study nursing for the full year, as with all the other nursing students. So those nursing labs are the same for all of us. So we look at learning how to do vital signs and simple things like how to brush someone else's teeth and make a bed, all of those things to more of those sort of emergency scenarios of, if someone's having a cardiac arrest, how do you work in that team and make that happen? And then in the midwifery labs, it's a little bit different. Everything we do has a midwifery focus. So we learn how to do abdominal palpations on mannequins. So we're looking at what position the baby's in, what their size might be. We also work with Victoria, who's another mannequin who has contractions and will do the whole labour and birth scenario, all the way to other skills where the lab technicians get really creative. So we learn how to take blood from a baby, and we can learn how to cut episiotomies using oranges. They're wonderful. And we get to do lots and lots of hands-on things. It's that sort of safe place to make those mistakes before going out on placement and working with real people.
Thank you so much for that answer. Chloe, what has been the most challenging aspect, or what is the most challenging aspect of your Bachelor of Nursing course?
So probably the most challenging aspect is the course content can get a little bit heavy, particularly in second year. But it's nothing that we can't handle. The teachers are really, really supportive, and, all the students work really hard together to ensure that we're doing our best. So just keeping on top of it, and it's fine.
Thank you. Keith, what does an average day in the life of a student look like? How much time do you spend in lectures? How much time with practicals? Stuff like that.
It's, as I'm sure everyone could imagine, for me, it's been quite different. Studying part-time and spending longer at uni. But an average day for me would be going to work at the cafe at university from 7 o'clock in the morning, getting off for maybe 2 or 3 hours during the day to go to a lecture or a tute, then going back to work until 3 or 4 o'clock in the afternoon. That's generally my average day, anywhere between 1 to 6 hours of classes a day and up to 10 hours of work a day. It's been, it's always quite diverse.
Thank you. Hannah, back to you. What support is there for nursing and midwifery students?
As a whole, sort of the nursing and midwifery school is super supportive, as Chloe and Keith said. The teachers are always looking out for you and ways to make, your experience of the course a good one. So the staff are amazing. There's always library resources as well. I've still got a booklet that they gave me in my first year that I use even now to help me with all my referencing. So they are a lifesaver. There are also peer mentoring programs, which are just amazing. It's a little bit different this year. So now every first year student is now part of the peer mentoring program. And that's based in groups of about 5 first year students to a mentor. So not only do you get to know that mentor and ask them for help and get that support, but you also get to know other students really closely as well. So you get to sort of help make those friendships. In nursing and midwifery, there's also the Monash University Nursing Midwifery Club, so Monk, and they organise social events like our annual ball and other events throughout the year. We can just get to know other students, and I think that's it. Past classes as well to help with anatomy and physiology. Lots of helping to sort of bridge the gap between high school and university study.
Brilliant, thank you. Chloe, what's one tip you would give to someone who is going into a nursing degree?
I'd probably just say keep on top of your study. If you don't take control of like your course sort of thing, it's kind of easy to fall behind, but just doing little bits each week really keeps you on top of it. And I'd also just say enjoy the course. Like, it goes by so quickly and it's so great, so just take it all in.
Wonderful, thank you. Keith, back to you. Once you become a registered nurse, how do you specialise in an area? Is it done internally with the hospital, or do you have to get further qualifications?
Generally both, for all the specialties I've looked at. I've got quite an interest in critical care, intensive care, emergency department, respiratory or cardiac care, which is really interesting, in-depth stuff like that. And from all the hospitals I've talked to over the past couple of years, they're really keen to train you up, first of all, as a bedside nurse, and then transition you into specialty care at the same time as you complete a master's degree or a graduate diploma. The hospitals tend to be really supportive of that, really supportive of staff who want to become more specialised, because Australia always needs more specialised nurses.
Wonderful, thank you. Hannah, could you possibly describe to us the advantages of doing a bachelor degree of nursing and midwifery as compared to just nursing on its own? How do you know if midwifery is for you?
Yeah, so it's always a bit of a tough choice. There's lots and lots of ways to get into midwifery. So for starters, if you can't or don't get the ATAR to get into that double degree straight away, there's lots of pathways to get in. For me, I chose to do the double straight away just because I just wanted to get it all done at once and didn't want to have to come back. And I also wanted to be able to have that opportunity down the track, as Keith said, to do like a postgraduate in critical care or something else, as opposed to doing my postgrad in midwifery. So there's lots of options that way. I think the main difference between doing nursing and midwifery and straight nursing is just that you get that midwifery component. You just get those few more placements. Employability wise, that double degree with nursing as opposed to midwifery is really great. With both nursing and midwifery, you are a lot more employable in rural areas especially. I'd like, fingers crossed, to work with the Royal Flying Doctors, and to be a flight nurse you need to be that dual qualified, just in case there's a birth mid-air. But otherwise, for the most part, it is a very flexible degree. So if you do go into nursing and midwifery and decide, oh God, no, midwifery is not my thing, you can always drop to the single, and the course path doesn't change because you're doing the exact same thing. So it's really great how flexible it is.
Wonderful, thank you. Chloe, could you tell us a little bit more about placements and how you get them?
So we do quite a lot of placement in our nursing degree. You have them every semester. The placement officers at the uni are really great. They try and put you in a hospital that's close to your home, so you're not traveling too much. And you can practically be put anywhere. As I mentioned, I've been in pediatrics, I've been in high dependency units, surgical units. They really try to give you as much opportunity to let you explore where you want to go and everything.
Perfect, thank you. Keith, one more for you before I've got a question for all of you. What has been let me rephrase. What was the transition from high school into university like for you? Was it difficult?
For me, because I didn't go straight into nursing from high school, it was probably a bit easier, as I had a background in youth work and studying youth work before I applied as a mature age student to do the nursing degree. But from a perspective of someone who watched a lot of students go directly from high school to the Bachelor of Nursing, it's a unique degree in that, yes, it's probably a lot harder than other degrees. So the transition could be quite difficult, but there are there's a lot of camaraderie. So it's a lot easier in that sense that you make friends, whether you like it or not. You're going to make friends in your first semester, and they're going to help you through it. So there's a lot more of a communal feel, which makes it really, really easy if you lean into it.
Brilliant, thank you. Now I'm going to continue in the same order, but this one's for all of you, so have a think. What has been the highlight of your degree so far, starting with Hannah?
I think all of the placements, they are just amazing. For nursing, I've been in ICU, and that was an incredible experience, not one that I thought I was going to get. And then in terms of midwifery, there's nothing like catching your first baby. And seeing your first set of twins born, and just all of those magical experiences of just, I think being invited into people's lives is something that is so unique in nursing and midwifery that you really don't get in any other degrees. And I think that's just the best part about studying.
That sounds so lovely, thank you. Chloe, what has been the highlight of your degree so far?
I was going to say placements too. It's so rewarding working with vulnerable patients and getting them healthy again, or to the best that we can. But I'd also say the friendships that you get to make. You get to meet so many amazing people, and you know, you're all going through the same stuff. And so, yeah, you can make some really great friends.
Thank you. And Keith, what has been the highlight of your degree so far?
The highlight of my degree so far has probably been this year being employed as what the hospitals call a registered undergraduate student of nursing, where you basically go around at a hospital and, you know, help out, which is fun and rewarding in its own right. But being on the inside of a hospital with my nursing skills and watching the whole COVID pandemic develop has been so unique and so rewarding, and has really given me a new appreciation for all those skills we learned in first year, like making a bed properly, washing your hands properly. You know, these are skills that will take you through your entire degree, and I've been able to use them to keep myself safe and keep everyone I work with and live with safe. So it's been, yeah, working as a roof sign has been probably the most rewarding part so far.
Wonderful, thank you. I've got another question for all of you. What's one piece of advice you'd give to a high school student wanting to study your degree? And I'll start with Hannah again, please. Sorry to put you on the spot.
No, it's a tough one, because I'm trying to think back to when I was there. I think just go in with an open mind and just give it all a red hot go. You know, there will be so many stages in the degree, whether that be on placement or in the middle of exam period, where you'll feel entirely overwhelmed and not sure whether you can do it. But because you've gone in with that sort of open mind from the very beginning, you've made all of those close friends. They'll carry you through it, and yeah, just really just be open to everything that's going on around you, because it's amazing.
Some good advice, thank you. Chloe, what's some advice you would give to someone in high school looking to study your degree?
I would probably say really look into the degree, know what you're getting into, sort of thing. I went into nursing thinking it was pretty much just medications and, you know, looking after wounds. So I was a bit surprised when I started learning, but like that there's so much more to nursing, but it just makes it that much more great. Like it's, yeah, a lot to it. So know what you're getting into.
Some more good advice, thank you. Keith, what advice would you give to a high schooler looking to enter your degree?
Yeah, I've said it before and I'll say it again. Make friends. In your first week, make friends. I'm not the most sociable person right off the bat, so I probably held out a little bit when I started my nursing degree, and it took me about 3 days to find people who I was going to spend the rest of my degree with. And last year, I was the groomsman to one of them at their wedding. Like it's one of those really unique degrees where, yes, it's hard, but it's made so much easier when you walk alongside other people and do it.
That's so gorgeous that you got to go to their wedding as a groomsman. Thank you for that advice. I've got a question for Hannah now. What electives are on offer, especially because you've got the dual degree? What did you choose and what did you like about them?
Yeah, so actually in the double degree, we don't get any electives. So in first year, when the nursing students all got to choose their electives, they got to choose between joining us midwifery students in our first year midwifery subject. They could choose to do a maternity and paediatrics unit. I think there was also wound care and maybe a palliative care one as well. So that was the only part of the degree where we get electives. I think it's quite a nice degree for someone who's as indecisive as me, because it's just kind of, you're in and that's it. You don't have to think about anything else. But yeah, so they were some of the electives.
Wonderful, thank you. Got a question for Keith. What is the balance of theory and practice like?
The balance of theory and practice, it feels a bit one-sided in your first year, especially in the first semester. Really, really theory heavy. But as you get further through the degree, you learn, or rather you're trusted with a lot more practice. Like occasionally you'll go on placement and you'll be asked to do blood pressure, and then you'll be asked to change sheets, ambulate patients, take bloods, and it kind of sneaks up on you just how much you're doing by the end of the degree. Yeah, so there's a great mix, but it's definitely very theory heavy at first, and it gets really practice heavy later on.
Thank you. I've got a question for Chloe and Keith. I'll start with Chloe. What specialties are you interested in exploring after you finish your degree?
I am interested in going into pediatrics. I love children. I think they're beautiful. They're so much fun. And so, yeah, hopefully I get to work at a hospital where there is pediatrics. Fingers crossed.
Fingers crossed. Thank you. Keith, what about you?
For me, it's been basically from day dot critical care, taking care of really sick patients and doing it really, really fast because you're really, really specialized. I've had, due to no fault of my own, I've had a lot of deteriorating patients over the years. So I've had a lot to do with intensive care specialists, emergency doctors, and just seeing them work, I've been in awe. So that's been my goal from then on.
Good answer. Another question for all of you. What has surprised you the most whilst doing this degree, or your degree? I'll start with Hannah.
I think just how much placement you get and how well you learn to cope with it. I think it's very, very unique in, throughout the whole degree. For the double degree, we're doing over 1,700 hours of placement, and you're doing that while studying full time, sometimes working other jobs. And just, yeah, you just kind of learn to cope and keep going and pushing through, and because you're doing what you love every day, it makes it so much easier. So I think that's something that's really surprised me from the beginning.
Thank you. Chloe, what about you? What's really surprised you about taking this degree?
Yeah, I'm along the same lines as Hannah. Like at the start of each semester, when you're looking at what you're going to be learning, how much placement you're going to be on, all that sort of stuff, you kind of have that moment's thought of, wow, that's going to be hard. I don't think I can do that. But it's surprising just how well you can do it. Like as Hannah said, it's just that passion that comes through that really keeps you going. And yeah.
Thank you. And Keith, what about you? What surprised you?
The thing that surprised me most during the degree was probably the extent to which I became more flexible and agile throughout the degree. Like, first semester, first year, I was worried about getting the perfect hospital corners, and that was really stress-inducing. And then over the last semester, you walk into rooms with deteriorating patients, and you're just like, oh, I know what's going on. I can write all this down, keep an eye on everything, be cool, calm, and collected. And you kind of don't realize how flexible you've got until you look back over the past, for me, 6 years and say, oh, okay, I've learned accidentally to be quite a flexible practitioner.
Just accidentally. Well done. Question for all of you again. How do you know if you'll be able to cope with all sides of nursing, like bodily fluids, before starting the degree? Hannah.
I don't know. I was always really into sort of those emergency TV shows like, you know, Ambulance and 24 Hours in ED and One Born Every Minute. Love them all. And I grew up on a farm, so bodily fluids is not something that has ever sort of grossed me out. If it is something that you are worried about, though, you know, you can look into sort of coping mechanisms, whether mindfulness is something you want to try and do while on placement, just to sort of help you with that anxiety. I'm not sure whether it's something you can really kind of learn the extent of before you start, but surely while you're on there, you can get so much support from other educators, other students, if that is something that you're struggling with.
Beautiful, thank you, Chloe.
Going into my nursing degree, I was a bit like, oh, I don't think I want to be exposed to body fluids. That's a little bit gross. But I was very surprised. It's very easy to handle when you're caring for patients and, you know, they do have body fluids going on. It's, you know, you're not concerned about it because you're just worried about their health and just making sure that they're okay and that you reassure them. It's the least of your worries at the time. So.
Perfect, thank you. And Keith?
I personally have always been kind of okay around bodily fluids, but I don't think it's something you can really, even if you've been around it a fair bit, you can really prepare yourself for before you start the degree. For me, it was exposure therapy. You know, get in, go in there, clean up the code brown, which is, you know, a fecal explosion of a patient, and just do your best and let your buddy nurse or your teachers or your tutors know, I'm not coping with this. Can I step away? Or how do you cope with this? And no one's going to think down on you because of that. If you speak your mind and say, I need some space, they're going to give you space and they're going to help you cope, because it sometimes sneaks up on all of us. I thought I was fine and perfect with it. I've been studying for 6 years, seen a lot of things. And last semester, I was watching a procedure done to an awake patient with their ribs. And I was like, oh, I'm getting a little bit lightheaded here. I'm going to step away for a little bit, and then I'll come back and keep watching the procedure.
Thank you. I've got another question for you, Keith. Are there opportunities for rural placements?
There are. Every semester I've had emails saying, would you like to do a rural placement? Are you open to doing a rural placement? Because often, not Peninsula Health, Monash University will have rural placements they need to fill because there aren't enough urban placements, and they prefer to fill them with people who want to go there rather than sticking someone who's not prepared to go there out there. But there's also opportunities for going rurally or remotely and not doing placement. I went to the Northern Territory with a private organisation called Northern Territory Private Health Care Network. And they took us around the Northern Territory for a week and a bit to talk to different remote and rural communities there about what being a healthcare practitioner is like. So there's all kinds of stuff where you get to see rural and remote sides of Australia. Plenty of placement, plenty of other things too.
Brilliant. Thank you very much. And I'm just going to finish it up here now. So thank you so much, Chloe, Hannah, Keith, for sharing your career insights with us. And thank you so much to our audience for joining us today. I hope this gave you a taste of what our degree in nursing and midwifery is like at Monash University. If you think these courses could be for you, make sure to visit our booths and have a chat with our staff. We hope to see you on campus soon, and all the best with your studies.